Hello everyone, my name is Courtney Watson and I am representing my conference presentation for this year's American Association for Sexual Educators, Counselors, and Therapists. I'm a licensed marriage and family therapist and as well as an AASECT certified sex therapist. The original presentation occurred on June 15, 2019 in Philadelphia, Pennsylvania. But because accessibility is important to me, YouTube is a great place to offer this work on a free platform to a wider audience. So let's go ahead and get started. Before we begin, I would just really like to pay my respects and acknowledge that this conference is being held on occupied territory and is the traditional lands of the Lenape people. I pay my respect to the elders, both past and present, of this civilization. A couple of words about nomenclature. So throughout this presentation, you will see African with an asterisk. And this is to acknowledge that African women are not a homogeneous group. They are neither homogeneous in beliefs, practices, needs, nor desires. And women in various countries among a variety of ethnic groups on the continent of Africa are the focus of this presentation. The next term that we'll address is Euro-American, and this term primarily is for white, cisgender, middle to upper class citizens of wealthy and powerful European countries, as well as the United States and Canada. With this definition, I do not intend to render invisible the many Americans who inhabit central or southern countries on our continent. I acknowledge that they are also American, but have their own history of colonization and are thus not included in the neocolonializing powers in the definition above. I'd also like to apologize in advance for the applied assumption that people with vulvas who undergo genital sculpting are female, and people with penises who undergo genital mutilation are male. I know that this is not true, and traditional African gender systems did not even adhere to Euro-American gender binary. So it's actually probable that folks with vulvas and non-binary identities who did not identify as female were not forced to undergo genital sculpting rituals with girls. But for the purposes of this talk, folks with vulva who are read as female are referenced as female, and folks with penises who are read as male are referenced as male. I invite suggestions on how to discuss this topic with gender-inclusive language in the question and answer portion. So in this presentation, we will understand the placement of debates about African genital sculpting practices within a neocolonialist framework. We'll challenge assumptions and misinformation about genital sculpting practices. We'll provide accurate information about African genital sculpting practices. We'll center African perspectives in genital sculpting conversations within the sexological community, and we'll showcase the multifaceted aspects of genital sculpting within and across cultures. In accordance with the conference theme, we will be addressing today utilizing healing approaches that decrease the shame associated with body image and somatic rituals, examining the role of spirituality, religion, and belief systems in education and therapy and counseling, identifying the role of ethnicity, race, acculturation, or assimilation in body image, sexual self-esteem, and pleasure, and appraising the role of spirituality, religion, and belief systems in body image, sexual self-esteem, and the ability to give and receive pleasure. So who am I to give this talk? I'm an African American who has not undergone any African culturally sanctioned genital sculpting practices, but has participated in American socially acceptable genital modification. I was inspired to do this presentation after watching an episode of The Good Doctor that absolutely enraged me. And there's passion and outrage in this presentation. I am intentional about not whitewashing that out, despite the commonly held sentiments that passion and outrage have no place in academic settings. Lest someone catch a whiff of bias. When processing with my therapist why I'm doing this presentation, when I don't actually believe it will shift international conversation about African women's vulvas, genital sculpting practices, I came to this conclusion. I stand behind my anger and my fire for this topic unapologetically because I do this for my ancestors who lost cultural traditions at the hands of colonization, I do this for me, my grief and loss in being disconnected from practices deemed barbaric or inferior to blue eyes. In this room, I fight this fight to ensure that others fight too, so that when my fight is either burned out or stamped out, the fight against neocolonialism, white supremacy, and misogynoir live on in those who saw my unhidden passion and outrage, and hopefully it fuels their fight to end these oppressions as well. Our definition for neocolonialism is a persistent imperialistic relationship between former colonies and colonizers, a colonial-like exploitation through indirect means. Traditionally, neocolonialism is considered a tool for economic or political control, but social and cultural neocolonialism is recognized as problematic as well. And we'll use this definition throughout this presentation as our basis for the neocolonialist lens. The colonial subject is created through measurement, comparison, and explanation of human difference that establishes the colonizer as superior. And throughout this presentation, the colonial subject will either be African women's vulvas, their genital sculpting practices, or African women themselves. So just a brief history. It is believed that genital sculpting practices began in the Swana region as far back as ancient Egypt, and spread along with Arab traders. For those of you that don't know what Swana is, that term is, it's a term that decenters like Europe as the central place on the continent. And so it's typically or commonly also referred to as the Middle East, but in this way of decentering Europe, it's Southwest Asian and Northern African region. And so I'll be using that in terms of addressing that region. So this is where it is believed to have begun. The 2nd century BCE, the oldest evidence of any sort of circumcision practice was found on papyrus paper in Egypt. And then also in ancient Rome, infibulation was practiced on slave women to prevent pregnancy. 1909 through 1970, these practices were considered a rite of passage, where circumcision was a ritual analogous to male circumcision. In 1909, ethnographer Arnold van Gennep was the person that first observed and recorded these practices, and then 1970, Nicole Sinzinger argued against it. It wasn't until 1970 that the rituals became constructed as a human rights issue, and the 70-year history of correlation to male circumcision was dismissed. In 1959, the World Health Organization, when presented to intervene in these practices, stated that this is a social and cultural practice and not a health issue, thus they were not going to participate in any sort of disruption of this practice. Again, in 1970, this became seen as a human rights issue. In 1990, the term female genital mutilation became the standard term, as opposed to female circumcision, which was used before. And this also was a term that became adopted by international organizations. There's been a recent rise in medicalization of these procedures. Both Egyptian and Malaysian government support the medicalization of the procedure for safety purposes, and this is increasing in sculpting countries, but all international organizations are opposed to the idea of the medicalization of genital sculpting practices on vulvas. So colonialism and African vulvas and neocolonialism. Through a colonial lens or neocolonialist lens, the belief that these participants are irrational, mistaken, backwards in thinking, uninformed, rejecting education, in need of rescue, barbaric, and women in perpetual victimhood. This is when we think about the colonial subject, the way that women with African women with vulvas are being perceived. And this is a re-emerging colonial ideology in the anti-FGM movement. Also, the renaming of the practice. We see first it was female circumcision, then it was genital mutilation, and now it's cutting. And even the renaming of a practice, those are not terms that like women with African women with vulvas who undergo these practices use themselves. Terms that they use for this practice is purification or bath, but that's left out of our wider conversation about this practice. So again, in reference to the creation of the colonized person, Okazaki, David, and Abelman say that there was enormous social and psychological and infrastructural work in producing the colonized person. And this is from their 2008 article entitled Colonization of Psychology and Culture. Colonization and Psychology of Culture. So there is enormous social, psychological, and infrastructural work in producing the colonized person, and we are going to see that soon. So again, you will see a series of clips from this episode of The Good Doctor, and this was my inspiration for the presentation. As well as watching this show, I could not believe how blatant the neocolonialist and disparaging frame was presented on primetime TV. And it was actually immediately after this show, watching this episode, that I wrote my conference presentation outline and submitted it to be presented at AASECT.
Genital mutilation is the ritual cutting or removal of some or all of the external female genitalia. Over 200 million victims worldwide, it is almost universally practiced in a number of African and Asian countries.
Where was she born?
Wisconsin. Yeah, it's way more common here than you think.
What religion is she?
I didn't ask. This isn't about religion. No legit religious organization endorses this stuff.
We're going to do the labiaplasty first thing in the morning. The damage done to her nerves is not going to get undone, nor is the sight damage, but at least she'll look like other girls. We should be able to have her out of here by 6 in the evening.
Outpatient. Why the hurry?
So her mother will simply think she's in school, then out studying with her friends. She loves her parents and doesn't want to tell them that she's rejecting one of their cultural traditions.
They won't stay in the dark for long since we're legally obligated to report them. That cultural tradition also fits the definition of abuse.
They'll also find out when we ask for their permission to do this surgery. She's a minor.
Her ID says she's 18.
Yes, her fake ID says she's 18. Her number starts with an H, which means she was born in the 50s. Also, the photo background is green instead of blue. Also, 6 other things.
Maybe we can get legal to get a court order.
If I believe that ID is real, then I'm entitled to perform this surgery without seeking consent of anyone other than the patient. And, as legally required within 36 hours, I will report the evidence of abuse under the name and address listed on that ID. If the investigation of that report doesn't begin until the girl is long gone and happens to lead nowhere because the name wasn't real, that's no fault of mine.
Are you sure you want to risk your medical license to protect an abusive mother?
If we do this by the book, we never see that girl again and no one gets help.
If we do this by the book, maybe the cops lock the parents up. We shine a light on this thing, her community gets scared, and maybe the next girl doesn't need our help.
Or maybe the testimony of the girl about what happened to her when she was 2 doesn't help the cops at all. Maybe the parents just take their daughter home, and maybe we scare the next girl into not even asking for help. I'm doing the surgery to this girl, under this name, tomorrow morning at 7 a.m.
So there are several things that were highly problematic about that clip and some of the language that the doctors used to describe what was happening. One, and this is something that we're definitely gonna come back to, is the fact that it was said that there was 200 million victims worldwide. And I know at first glance, without a lot of information about genital sculpting practices, that makes sense and that's in alignment with a lot of people think. Hopefully there can be more information provided through this presentation that might offer a different perspective. Legit religious organizations, as if it's not legitimate for this to be a cultural practice. The idea that she'll look like other girls as if she doesn't already look like other girls, or the fact that her genitals are the things that makes her looks like other girls. Only her vulva, and if her vulva looks a particular way, will determine that she looks like other girls. And also just completely ignoring the fact that there are also other girls who have genitals and vulvas that look like hers, because they have also undergone the same practices. This idea of that cultural tradition being abuse, that's something that we really have to look at, because who gets to determine what abuse is and through what lens? And in this instance, it's definitely through that Euro-American lens that we're talking about. automatically identifying the mother as abusive is highly problematic, and also just kind of reminiscent of Freud, as if the mother is always the problem. And then this intentionality around scaring an entire community, and the implications that has in a country of all of the things that are happening with immigrants right now.
Our 16-year-old daughter is lying in a hospital bed, unconscious, to protect her from overwhelming pain because of what this place did to her, without our permission. And you are investigating us.
Your daughter is suffering because you butchered her when she was 2 years old.
Dr. Lim, please refrain from unsubstantiated allegations.
Either they're the butchers or they're protecting the butchers. If you didn't do it, tell us who did.
It was an aunt and a grandmother from Kenya. They were watching Mara while we were on vacation.
Oh, you must have been horrified. Did you take her to a doctor? That girl's sex organs were covered in scar tissue. She had no medical attention to treat any of her wounds.
She was fine. She was happy, laughing. It's not that big a deal.
I was cut. My mother was cut. Her mother was cut. It is a rite of passage connecting our women to their ancestors. She will not find a husband in our culture if
So
she
she'll
is not...
find someone else. It's not that big a deal. These parents forfeited the right to make any calls about their daughter a long time ago.
Our daughter is an honor student, taking 3 AP classes in her junior year. Went on a mission to Haiti to build a school. We have raised her well. She's a good person. We're proud of her.
I'm sure she's a good person. You are not going to convince me that what happened to Mara when she was 2 years old is anything short of an abomination. But that's not the issue today. The issue is, how do we best help this girl now?
The clitoral reconstruction should protect the exposed nerve.
Should.
That is the surgery that, in my medical opinion, is called for.
But it's not the only option.
We could ablate the peripheral nerves and remove the remaining clitoral tissue.
And is that surgery safer or more dangerous?
It's simpler, but that's not the only factor here.
It's the only factor to us. We want to know that our daughter won't spend the rest of her life in pain.
Please, for a moment, can we think about something other than Mara's pain? Can we think about her pleasure? We have a chance to give her a healthy, meaningful sex life. That is what she came here looking for.
Wake her up.
She's in pain, and she's already told me what she wanted.
Yesterday she was requesting cosmetic surgery. Today you're asking her to risk a lifetime of pain for a chance at pleasure. From everything I've heard, she's mature enough to make the call herself. Even if it means suffering for a few minutes to do so. I'm a social worker. Your parents know what happened, and Dr. Lim gave you a nerve block.
It hurts. It still hurts.
I understand that, and we are going to try to get you back to sleep as quickly as possible. But something happened during your surgery, and we need you to make a decision about what is done next.
We believe that despite what was done to you as a child, the reason you're in so much pain is because you still have functioning nerves in your clitoris. Nerves that had been covered with scar tissue. I'd like to repair that. We can make you physiologically complete.
But there's no guarantee that will work.
I'm confident.
There is a safer choice.
We could remove your entire clitoris.
This is your choice. You will be protected no matter what.
Take it out, Mara. We can make you whole.
I made a mistake. Take it out.
She's on medication. She's in pain.
Dr. Lim, please let her go back to sleep. And prepare to operate to remove the damaged tissue.
So, again, so many things that were problematic about this clip. Just a little bit of information about what happened between the labiaplasty and when CPS was called on the parents for abuse and they came in. The labiaplasty to remove the scar tissue exposed the clitoris, but there was still active and alive nerves within the clitoris. And because everything had been removed and exposed, Mara was in so much pain that they had to give her anesthesia and put her under in order to manage the pain. So they actually had to knock her unconscious because of the operation that was done by this doctor. It's funny, when I presented in a room full of sex therapists and sexologists, the major question was, did this doctor even know what an actual clitoris looks like? Because, of course, there's still nerve endings that are alive and like scar tissue. The clitoris is more than just the little bud that we see. That's only the glands of the clitoris. And so, yeah, like, did she even know what a clitoris looked like before she performed the surgery? Because, of course, this would be an outcome. I don't know. I don't know if that was just like an oversight on Hollywood, if it was an intentional oversight or what. But the solution of ablating the clitoris nerve, they can't actually take out the entire clitoris. Like, it's a whole entire organ and structure. I encourage you to Google like what a full clitoris looks like to understand like why this was a little bit off for us. But in terms of the clip that we just saw, like, so many problematic statements. You butchered her, butchers, you must have been horrified. This idea that the only way to have a healthy and meaningful sex life is if your vulva or your clitoris looks a particular way. The social workers comment that what the parents did was an abomination. The doctors comment that somehow she could make this person physically complete, as if Mara was not physically complete already, or the completion is solely dependent on what genitals look like and genitals looking in one particular way. Also highly problematic was the fact that the doctor determined that the parents forfeited the right to make calls about their daughter, which we will definitely look like within a neocolonialist framework. And also this doctor's assertion that she can make Mara whole somehow, as if Mara is not a whole person and only this doctor has the ability to make her whole. And then also just the parents' counter arguments. Like, I really appreciated and loved that there was this fuller picture of Mara beyond her genitals that was presented to her parents when they talked about all of her achievements. Like, her vulva is just one aspect of herself and there's so much more to her. And also just this other explanation of what this was, as it being a connection to ancestors, as it being a rite of passage. The fact that it is something that's intergenerational and that you can still raise somebody well who has undergone a genital sculpting practice. What's really important is this idea that Mara was happy and laughing, and that's really not a picture that we get in our mainstream neocolonialist Euro-American reference or lens for genital sculpting practices. It's always little girls that are being strapped down against their will and they're crying and screaming, but actually, like, being happy and laughing is something that African women repeatedly also say about this experience. Like, yes, there is pain and there is also joy and fun in like the rituals around this. And so we will also be talking about that a little bit later on. But one thing that I think is really important to look at is the neocolonialist disruption of family systems. And this within this frame, we saw that the disruption through parent-child and also the disruption through husband-wife. So yes, parents losing the right to make calls about their daughter. This is something that we commonly see in colonialism and neocolonialism, where children are taken from their homes and they're put into missionary school or European school or Western school because somehow the parents don't have the right to make decisions about them. And then when they are taken away from their family and they are taken away from their culture, they are kind of like indoctrinated in one particular lens, in the Euro-American lens, and then brought back to these places and like really disconnected from their original culture. And that is absolutely a tool of colonialism and neocolonialism. And also the separation of husband and wife, so the disruption of family systems. Like, if you do not engage in this practice, you will not marry someone in your culture. So where will you marry? Does that mean that you will marry someone who's European or American? And does that mean that in terms of like, particularly on the continent in the areas, in terms of like inheritance and wealth and like transfer from parent child, that all of a sudden things get outside of the culture in terms of like wealth or inheritance of land and those sorts of things. So disruption of husband and wife and family systems and connection and bringing in people outside of those cultures is a huge tool for colonialism that we hear very clearly in this. Is like, who cares if she can't marry a husband in your culture? That's fine. I guess she'll just marry someone from ours. And then again, this idea that it is the neocolonialist who has to intervene and make you whole, because as an indigenous person with indigenous practices, you can't actually be whole the way you are. It is only us who can make you whole. Highly, highly, highly problematic. And just to bring this home a little bit more, here is a confidential report from Sierra Leone. It's the Memorandum of a Scheme for the Introduction of English Elementary Education into the Protectorate of Sierra Leone in 1914. And there was a British officer who said, there's a great possibility that any system capable of influencing and molding the girlhood is likely the soonest to substantially influence the general population. So let's bring in our particular education and framework, take these kids out of their home, and then once we do that and bring the girls back, we'll be able to influence the general population. This is also about the attack on girl sexuality. If we can say that girl sexuality needs to be one thing and we transform the idea of what girl sexuality is supposed to look like, then we can transform the general population. And I don't really think that this is like for fun or so that like we can have better relationships. Is actually completely about power and control. So yeah, it's restructuring African families and gender roles to expand colonial rule, manipulating African women in order to move them away from field work or polygynous families towards Western models of housewives and mothers. That was part of imperial politics as a way to gain power and control. So we're actually going to look at what female genital sculpting truly is. So female genital sculpting primarily occurs among indigenous African, Asian, and Swana folks and practitioners, where it occurs on every continent, although predominantly among those folks with African, Swana, and Asian heritage. Although when we're talking about this, we're talking about a very particular type of genital sculpting, because there are genital sculpting practices that occur on every continent amongst all of us, not just folks with Africa, Swana, and Asian heritage. And then the types in this particular cultural context is anything from Suna to infibulation. And infibulation, as we will learn, is the sewing. This is what we see as the most problematic, the ones that are generally the pictures that we see, people screaming, being tied down, and this is actually only 15% of the genital sculpting practices are in infibulation. So what is genital sculpting? It can be the removal of the clitoral hood. It can be a clitorectomy. It can be removal of part or all of the clitoris along with the labia minora and labia majora. It can be a pulling or elongation of the labia minora and or labia majora. It can be the insertion of products into the vagina. It can be removal and stitching of the labia minora and labia majora, and also incisions or pricking on external genitalia. So this one is what a vulva looks like that has not been sculpted. And there are levels that we'll talk about. So this is level 1, this is level 2, this is level 3. So type 1 or level 1 is the removal of the clitoral hood and or the clitoris head. So type 1A is removal of the hood only. Type 1B is partial or full removal of the clitoris and removal of the hood. Type 2 is removal of the labia minora, the labia majora, and the clitoris head. So type 2A is the labia minora only. Type 2B is the labia minora, partial or full clitoris, and then the clitoral hood. And type 2C is labia majora, labia minora, partial or full removal of the clitoris and the clitoral hood. Type 3 is removal and fusion. Type 3A is the removal of the labia minora, possibly the clitoral hood and part or all of the clitoris, and also a fusion or infibulation. So this can be a sewing, or it also might not be a sewing or stitching. It could just be that the wounds are fused together, are fused when they heal together. And then type 3B is the same process, but with including of the removal of the labia majora. So this incision is the labia minora, and this incision is wider. The stitching is wider to the labia majora. So for those of you who are sensitive, I will have some graphic images, and this next slide is an image of genital mutilation. And this is genital mutilation type 2 that occurs in Los Angeles.
But I removed 100 cc's of fat from the mons pubis. She's young, she hasn't had kids, she was just born with excess labia with this shape. The pieces that I removed off her labia, you can see she had these very long wings on both sides, extended past the labia majora, so you can see how this extra tissue would create a lot of discomfort. And then she had extra pieces of clitoral hood on both sides. That flattened the bulge that she had in that area that she could see in leggings. And I wanted to show a diagram now of her labia. Full excess pieces of clitoral hood. One side had more folds than the other, and they were fused. And so I put a dotted line to show where I made my incision. She also had asymmetry of the wings. This one came down farther and was artistic and technical part of this surgery is taking down all those extra little pieces, sewing everything together so it flows naturally and looks very even and symmetric.
So the previous diagrams that we saw were from the World Health Organization, and this was from an article on guidelines on the management of the health complications from female genital mutilation. And what we're seeing now is an Instagram post from Dr. Catherine Huang, who is a board-certified plastic surgeon. She performs several per week to 3 per day, in her own words, of labiaplasty, at rates ranging from $8,000 to $12,000. And her labiaplasty procedure that she just described is exactly what that female genital mutilation type 2C would be considered on an African vulva. So when we think about this lens that's applied, that's Euro-American, and culturally sanctioned practices, female genital mutilation is legitimized by the medical industry, and it's okay as long as these vulvas are not African vulvas, and as long as you can charge $8,000 for these procedures. This is the exact same procedure. It's the exact same thing as what would be considered female genital type 2C in terms of the removal of labia majora, removal of labia minora, partial removal of the clitoral hood. It's the exact same thing, but because it's happening in a hospital or among a board-certified plastic surgeon, apparently it doesn't count as female genital mutilation under those circumstances. So this is just a little bit more about what Dr. Catherine Huang has to say. I specialize in vaginal plastic surgery, labiaplasty, and vaginal rejuvenation procedures, and have seen a 70% increase in these types of procedures in the last year. When performed with meticulous attention to detail and my technique, there is a quick post-op recovery. Most of my patients just take a Tylenol for a few days of pain meds, and most return to work the next day. I often combine labiaplasty with vaginal rejuvenation, which tightens the vagina, and studies show that vaginal rejuvenation increases sensation of the clitoris in the G-spot. So, when a doctor in a Euro-American context says this thing is okay, there's actually a high demand for it. It's not very painful, and like a few pain meds will take care of this procedure, and it can actually increase like sexual pleasure. We believe it and we understand it, but when African women say the same thing about similar to same procedures, all of a sudden it's mutilation, and we can't believe them. They're misguided. They just don't know better. And if only we can intervene, we can actually make them whole or understand. That is exactly what colonialism is, and this is neocolonialism. I have a little quote from Dr. Catherine Huang because I just thought it was, I don't know, it was interesting that for her, all of my post-op patients have the perfect vagina. So again, it's okay to have this procedure done and perfect, according to Dr. Catherine Hong, but maybe even some of the groups that practice African genital sculpting, to shift and perfect the vagina. It's okay in one situation, but it's not in the other. So again, I'm going to be showing graphic images of genital mutilation in the next slide. So type 4. So there's 3 types and then there's type 4. I'm really questioning about terming this or understanding this as mutilation. So type 4 is all other operations of female genitalia, including pricking, symbolic nicking, piercing, stretching, or incision of the clitoris and or labia, cauterization by burning the clitoris and surrounding tissues, incisions to the vaginal wall, scraping or cutting of the vagina and surrounding tissues, and introduction of corrosive substances or herbs into the vagina. So I have pictures of female genital mutilation type 4 under these circumstances. Piercing. Introduction of corrosive substances, aka a yoni detox. Also, a yoni steam would be considered type 4 mutilation, and also like yoni smoking, stretching, cauterization or cutting. This is aka vaginal rejuvenation because there is cauterization with this process. So again, we look at, is this mutilation? It's not mutilation in a context outside of African vulvas, but when African vulvas are involved, type 4 mutilation is considered. I'd like to present an anti-sculpting argument. This is from Fran Hoskin, who is someone that was highly influential in naming African genital sculpting practices as mutilation. Actually, she's been attributed with coining that phrase. And her perspective is, it is evident that female genital mutilation can be abolished and wiped out in our lifetime. We are able to teach those who cling to distorted beliefs and damaging practices some better ways to cope with themselves. Why am I pursuing this? I feel that my own personal sense of dignity and worth as a woman and human being is under attack by these mutilations, inflicted on helpless children for no other reason that they are female. I cannot tolerate this. These operations have continued for 2,000 years to the present time only because they are demanded by men. And who is Fran, you might ask? She was a wealthy Harvard-trained furniture designer who was cited as coining female genital mutilation, and she used her influence to put female genital sculpting practices on the United Nations agenda, as well as undertaking a research project that was highly influential in the World Health Organization's decision to end these rituals. She was accused by cultural genocide by anthropologists of the time. And as you remember, in 1959, when it was presented to the World Health Organization to intervene in these practices, they said no, because this is a social and cultural practice and it is not a health concern. But due to the work of Miss Hoskin, that perspective had shifted. And this is a African response. It was an anonymous response in an open letter. And this person wrote, I'm writing this letter to thank you very much for the compassion you have been showing lately for the hardships that I have to go through as an African Black woman. If it was not for you, I would still be thinking that genital mutilation was circumcision and that it was an integral part of my culture. I'm glad you opened my eyes to the fact that circumcision was in fact a male conspiracy to reduce my sex drive, kill me at childbirth, and a means of passing AIDS to me. For coming to my rescue, I am eternally grateful. So, of course, this is like tongue-in-cheek, and this is not actually how this person feels, but it really points to this idea, you know, when the doctor says we can make you whole, this Euro-American perspective that Euro-American intervention is the thing that changes and makes things better and that actually brings life to people or saves people. And what this person is really pointing out is how actually disruptive it is and condescending it is, and the fact that people can make their own choices. So Dr. Joyce Russell Robinson, in her article on African female circumcision and the missionary mentality, states, indigenous explanations for genital cutting are presented out of context, simplified and hyperbolized, then dismissed as irrational and based on superstition. People have the ability to make decisions about their body. They don't need Euro-American intervention, and we're going to look at this more. So what are actually the meanings of these practices from an African perspective and not from a Euro-American perspective? Genital sculpting practices are engaged for purification, to mark reproductive maturity, identification with the social group, to be normal, hygienic purposes, to curb excessive sexual engagement, to test male virility, and to promote female virility. This procedure, these rituals occur, sculpting practices occur right alongside of things like cooking and childcare. And in the next slide, we'll see a brief interview from someone that's actually undergone this practice. So again, this is an interview by Dr. Joyce Russell Robinson, and she asks, "Why were you circumcised?" And the person responded, "I could never marry if I did not get it." And when she asked, "Was it painful?" the person responded, "Yes, it was very, very painful. But it started to be fun when we started to heal. We learned songs, dance, learned to cook, and plait hair." This is the second time that someone who is familiar with the practice names that there was not just pain involved, but that there was also fun and laughter. The first time in this presentation was when Mara's dad named that was her experience as well. So when we're looking at this through a Euro-American lens, it's not a helpful way to really look at what this practice means. But the lens tells us a couple of things. And one of the things that it says is like the difference between Euro-American lens and Afrocentric lens is that Afrocentric pleasure is not centralized in the clitoris. Masters and Johnson's theories on female pleasure is what centralizes female pleasure in the clitoris. That is not a cross-cultural perspective, and it does not apply to all cultures. But when we apply our lens and look at other people's pleasure through our lens, then this is how we get disruptions and inaccuracies about what's actually happened. Orgasm is actually still possible with circumcision and also via the vagus nerve. And so oftentimes people are saying, but what about people's sexuality and how they feel? Folks with a complete spinal cord injury at T10 or above report orgasm and vaginal cervical awareness. So if you can have a complete spinal cord injury and feel and be able to experience orgasm and vaginal cervical awareness, you can also do that if you have undergone a genital sculpting practice. And that research was done in 2004. It was by Kamasuka, Whipple, Crawford, Louis, Kalnin, and Mosier. Kamasakru, I'm sorry. And then that was on the article of brain activation during vaginal cervical self-stimulation orgasm in women with complete spinal cord injury, fMRI evidence of mediation by the vagus nerve. Sexual satisfaction is a community investment over an individual investment in an African context. Euro-American lens says your sex is yours and your satisfaction is yours, and it's very individualistic. That's not true in the African context. The community is invested in sexual satisfaction because it means that couples stay together or families stay together, and that's not an individual thing. One of the major issues that people might point to as a problem is the age of consent. And again, we're applying a Euro-American lens to when someone can give consent. So our notions of the appropriate age of consent onto other cultures is not okay. At least here in the United States, it's not an ingrained cultural practice to teach girls under the age of 12 about their genitals. Yet in other cultures, preparation for these early initiation rites involve things like teaching your girls to stretch the labia minora. If a 6-year-old has more in-depth understanding of her genital anatomy, than maybe a woman that's over 30 in the United States who does not know what a labia minora is or how to touch it or feels uncomfortable touching it, then who are we to say that someone who has that knowledge, regardless of their age, is not able to actually give consent to things that are happening to their bodies? Also, not all of these practices happen on young girls. It's a common myth, and it's not actually true. One thing that we have to look at is actually the Euro-American influence and the neocolonial influence on these practices. And is it easier for it to happen on young girls than the older women? Is the actual pushback around these practices one of the things that is a contributing factor to it happening to girls younger and younger than was previously? Because this was always a practice that was done around age of, well, maybe I shouldn't say always, but primarily a practice that was done around coming of age rituals. And then at that time, someone definitely has the ability to give consent. We also have our own history in the United States of clitorectomies. Up until 1925, this was something that was taught in med schools. And clitorectomies were used as a tool to curb masturbation in children, as well as to curb sex workers up until the 1960s. But what about pleasure? This is the major argument for why this should not happen, because these practices, genital sculpting practices, impact African women's pleasure. So, one, orgasm and pleasure is considered from a Euro-American lens instead of an African lens. And one of the ways that we can see these differences is that, at least in a West African context, or indigenous West African context, dryness is preferred over wetness. So in our lens, like when you think about sexual pleasure, there's this fascination or strong desire for wetness, but that's actually not true in the indigenous West African pleasure realm. Like, the preference is for dryness. And then also the devouring vagina. In our Euro-American lens, the penis holds all the power, but actually in a West African lens in particular, it's the vagina that holds all the power, and the vagina devours the penis. And so when we hear these ideas that that somehow these practices are about like increasing male power, that's actually not true. Some of the beliefs around removing the clitoris is because the clitoris is an indication of maleness. This argument is used as to indicate circumcision is to devalue women, but that's from our understanding that places the penis at the center of power instead of the vagina. At least in a West African context, the vagina is powerful and it devours the penis. And so removing the clitoris, is that a demotion or is that a promotion? If this is to heighten the sense of femininity and femaleness, and the female sex organs are the ones that have the power, just because you remove the clitoris doesn't mean that you're taking away power. It could actually be increasing it. And then who gets to determine what is whole, what is healthy, what is beautiful? The idea that it's not whole, healthy, or beautiful to have a sculpted vulva just does not line up for the fact that what we just saw about labiaplasty and how like it's continually increasing in desire. So at one hand, we're saying you can't sculpt your vulva. On the other hand, here in the United States, we are sculpting our vulvas and doing so in procedures that look very similar to the sculpting practices that are happening on African vulvas. There have been several studies in Egypt, Eritrea, and Sudan that have found that women with sculpted genitals still achieve orgasm. And also there was a study done in France from 2007 to 2009 where they asked women who had experienced genital sculpting practices if they would be interested in vulvar reconstruction. And only 1/3 said that they actually wanted their vulvas to be reconstructed. That means 2/3 did not. So again, based on reports from women who have sculpted vulvas, and who were surveyed about their sexual pleasure, there's no conclusive evidence that they do not enjoy their sex life, nor that they experience sexual dysfunction. And again, when we come back to this idea of who's to say what vulvas, beautiful vulvas look like, sculpted vulvas actually are beautiful in that cultural context, and the unsculpted vulvas are the ones that are seen as not beautiful or not right. So as we talk about pleasure, we definitely have to talk about the risks. So there are risks with these procedures. There's risk of hemorrhage, shock or death, blood loss, anemia, impact on child development, septicemia, and tetanus, and painful sex. Death is rare. And empirical investigations into long-term complications are missing. These risks are typically over-reported while benefits are minimized. We don't hear anything in the literature about the benefits. And in 1990, there was research done that found that it was actually only type 3 that caused serious health and obstetric complications, while type 1 and 2 did not. The quality healthcare can minimize consequences. And so, like, again, there's countries and groups that are moving towards medicalizing this procedure, but many of the international organizations are against medicalizing these procedures. So why would you seek to abolish it over taking a harm reduction approach and medicalizing it? And especially if quality healthcare can minimize consequences, and especially since we have medical circumcision in our country anyway, beyond plastic surgery, which we'll talk about in a little bit. The World Health Organization actually found that psychological and sexual consequences were inconclusive. So we hear all about these risks and how terrible this is and what it's doing to girls, and all of that is a veneer. It's one way of looking at this, one way that over-reports the risk and minimizes, if at all, explains the benefits. So this is a map of where female genital sculpting is actually practiced. We see the areas in red and yellow and orange are where it predominantly occurs, but I do want to say that this is limited to indigenous cultural sculpting practices. This does not include labiaplasty. This does not include yoni steams. This does not include yoni detox that are popular probably in the United States and Europe. This also doesn't include piercings, clitoral or clitoral hood piercings, which are also genital sculpting practices. So this map is limited to indigenous cultural customs. So, anti-harm reduction, recognizing the medicalization of practices that violate the physical integrity of girls and women and thus their rights could legitimate them and contribute to their persistence. This is an anti-harm reduction stance. There is the possibility to have these practices medicalized so that they can be safer and people can still engage in them, but the concern is that you will legitimate them and contribute to their persistence. And I have a picture here of a medicalized genital sculpting practice that has been legitimated and is persistent and pervasive throughout the world, and especially in this country, and that is the genital circumcision or genital mutilation that occurs on young boys. These are the places where male genital mutilation is practiced. Neonatal circumcision is popular in the United States, Canada, West and Northern Africa, Southwest and Central Asia, Australia, and New Zealand. 4.7 million newborns were circumcised in the United States between 1988 and 2000. 75% of the non-Muslim or Jewish males 15 or older are circumcised in the United States. So Muslim males are the biggest male circumcision population. We all know that Judaism is also has a very huge tradition around male circumcision, but of the United States men who are 15 or older who are not Muslim or Jewish, 75% of them are circumcised. And globally, there are 661.5 million males who are circumcised worldwide. So I told you to keep in mind that figure of the 2 million victims who experience female genital sculpting. There are 3 times as many male victims who experience male genital mutilation, but because it's African vulvas or women of color's vulvas, the victimhood is applied. That's not applied with males. Male genital mutilation is practiced in the United States of America. This is another warning. There's going to be graphic images of male genital mutilation on the next slides.
Newborn circumcision is a different story. In newborn circumcision, we tend to perform these procedures either in the clinic or in the labor and delivery suite. This is a restraining board on which we place the infant, and then they get placed in these Velcro restraints so as not to move during the procedure. There are many different types of clamps that we can select. In general, the most common types of clamps are the Gomco clamp, the Plastibell clamp, the Mogan clamp, and there are some others that we use less frequently. There tends to be no difference in overall complications based on the clamp type that is used. However, there is a higher bleeding risk with the Gomco clamp. The Gomco is my own personal preference. There is a risk of higher site injuries and serious complications with the Plastibell clamp. And the Mogan clamp tends to have higher injury rate to the tip of the penis that we call the glans penis. This is a depiction of what the different types of clamps look like. This is an illustration, basically. On the left side of the screen, we see the Mogan clamp. In the middle of the screen, we see the Plastibell clamp. And on the far right, we see the Gomco clamp, again, the one that I tend to use. This is how the procedure is depicted in illustrative form. On the top, we see the Gomco clamp. The bell is placed over the foreskin. After that, the arm is inserted and placed in position, and the nut is screwed down, and we remove the foreskin as depicted here. The Mogan clamp is a little bit more direct in that the foreskin is drawn up into the Mogan clamp, it is clamped down, and the foreskin is then excised. And with the Plastibell clamp, the little plastic bell is placed over the glans penis, and then a tie is used to essentially constrict the area of the foreskin that will eventually fall off, and we'll show you that. So just starting with the Gomco clamp, this is named after the company that produces it, Goldstein Medical Company. The Gomco clamp is depicted here. Again, this is an apparatus that is entirely put together. This is the bell of the clamp, this is the arm of the clamp, and this is the nut of the clamp. And again, an illustration over here of how the clamp procedure is performed. First, we make an incision in the foreskin, place the bell over the foreskin, engage the arm, screw the nut down to constrict the penis so that there's no bleeding. We excise the foreskin, and then finally we have this final product of a circumcised penis. This is a live depiction of what that looks like. Basically, here we see the foreskin that's been drawn up into the clamp over the bell. The arm is being connected to the bell. It then gets screwed down. We excise the sleeve of foreskin, and the final product is the circumcised penis. The Plastibell clamp is depicted here. This is a plastic apparatus that is essentially made of the plastic arm and the bell that is inserted over the head of the penis, and then we use a suture to constrict down where the ring remains on the penis after the bell is removed. We excise the foreskin, the ring is remaining in place with the suture, and a few days after this is placed, about 3 or 4 days, this plastic ring will fall off at home, and there's a final circumcised product in that capacity. Again, a live illustration. The foreskin is drawn up over the plastic bell. The plastic bell is then engaged in position with the suture placed over the ring at the position where we want to produce the circumcision site. The foreskin is excised, and then the child would go home with a plastic ring still in position that's sutured in place. That suture constricts the skin so there's no bleeding, and then the plastic bell and the little edge of the skin will fall off later. Then we have a circumcised penis. So the Mogan clamp tends to be the clamp that is used most in the Jewish tradition for bris procedures. In Hebrew, Magen means shield. So the Mogan clamp is depicted here. Essentially, after the adhesions inside the foreskin are reduced, the foreskin is drawn up into the clamp is compressed down, and the foreskin is excised, and it is a much quicker procedure, but again, there are some increased risks with injuries to the head of the penis, as there's no bell that is protecting the head of the penis.
I just want to name one of the first pictures of this presentation was an infant that had just been born being strapped down to a board with restraints. And when we think about consent and children's ability to make decisions about their body, how traumatizing that must be. How traumatizing to just have been in this very warm, comfortable sack to being placed on a plastic board and strapped down so that you cannot move your body, and then have pieces of your body part cut off. And I don't understand how this is not also considered mutilation if we're going to say that the procedures that occur to African women's vulvas is mutilation, how this is also not mutilation. And how this is okay and legitimized and occurs in hospital settings amongst folks that do not have any sort of like ethnic or cultural tradition around this. But folks that do have ethnic cultural tradition and all sorts of meaning behind this are somehow told that like this is mutilation. So I just want to like name the trauma of being strapped down to a board after just being born, and also like how does that play into like some of the toxic masculinity and the ways that we socialize men and the struggles that men have later on in life. So this is arguments for male genital mutilation. We have been told that they reduce the risk of HIV. But actually, the issue around HIV is more about hygiene rather than circumcision status. There was a study done by the World Health Organization on sub-Saharan Africa that wanted to target and introduce male circumcision into non-circumcising communities. And what they found was that in terms of HIV status, well, that's what they were seeking to address. It is actually penises that are uncircumcised with good penile hygiene or low penile wetness or smegma have the same prevalence rates of penises that are circumcised. It is only uncircumcised penis that have poor penile hygiene and higher instances of penile wetness that are at higher risk for HIV. So when we think about circumcision being the cure for reducing HIV risk, it's actually not whether a penis is circumcised or not that is a determining factor for HIV risk. It's whether the penis has whether or not there's good penile hygiene practices. And so again, when we think about harm reduction, is it necessary to try and introduce a practice, one, that you're trying to take out of African female context, but introduce a practice into African male context around circumcision, one, amongst communities that don't want to circumcise and eradicated male circumcision a long time ago, but also do you have to introduce it as opposed to just spending those efforts on like information and education around penile hygiene. Another issue that has been found is, or stated for why male genital mutilation should occur is penile cancer. But it's in fact there's 2 complications for every 1 case of penile cancer that's prevented. And it's same for urinary tract infection. The argument is that it reduces urinary tract infection before the age of 1. But there's actually 1 complication for every 6 cases of urinary tract infection that is prevented. And urinary tract infection it's uncomfortable, but there's also things that you can do. It's not like deadly. It's not going to kill you. And it's also not worth having 1 complication for every 6 that are prevented. And so what are the complications when we think about male genital mutilation? Clinical complications, so these are complications that actually happen in the hospital, are bleeding, hematoma, womb infection, anesthesia-related events, excessive or insufficient skin removal, problems with urination, erectile dysfunction, problems with appearance, injury to the glands, sepsis, and lacerations of the penis and scrotal skin. So these procedures are also not without their risks, but we do not hear often about the risk of male genital mutilation that's happening in hospitals. So in these cases, the benefits are overemphasized and the risks are minimized, where in the cases of African genital sculpting practices for girls, the risks are overemphasized and the benefits are minimized. The American Academy of Pediatrics, the Canadian Pediatric Society, and the British Medical Journal all cite that there is no medical reason for neonatal circumcision. It is not medically necessary. It is a cosmetic procedure at this point. So I want to take a look at the differences between the practices Mara, an African girl who undergoes genital sculpting practices on her vulva, and Scott, an American boy that endures genital mutilation on his penis. So the reasons for these different practices are pretty similar. Mara undergoes this practice for femininity, Scott for masculinity. Mara for social or cohort cohesion in terms of rituals. If Scott is Jewish or Muslim, then this would occur for the same reason, for social or cohort cohesion and rituals. But also, if he's not Jewish or Muslim, the idea that boys' penises should look a certain way, and so the social cohesion is around like appearance for penis. Ethnic or self-identity for Mara, again, if Scott is Jewish or Muslim, it's for ethnic or self-identity. Spirituality for Mara, spirituality for Scott. Male preference in terms of partners for Mara, female preference in terms of partners for Scott. And there was actually a study done in Washington State, in Denver, where fathers were asked why they had their son circumcised, and a lot of it said, the majority of them said that they didn't want their son's penis to look different. Mara undergoes this to avoid bullying. Scott undergoes this to avoid bullying. Mara undergoes it for hygiene. Scott undergoes it for hygiene. Mara undergoes it for connection to ancestors. Scott for connection to ancestors, even outside of the Jewish or Muslim traditions, like the idea that my dad's penis looks like a certain way, so my penis should look that way, is also something that is a reason or decision making for parents in deciding to have male genital mutilation on their sons. And also the difference for Mara is it's also tied to marriage. So the World Health Organization created it, or put out a statement on the difference between these two practices. And what they said was, while both male circumcision and female genital mutilation are steeped in cultural traditions, the health consequences of each are drastically different. Male circumcision may seem familiar as far as definition is concerned, partial removal of external genital, but in practice is substantially different. It is the manifestation of deep-rooted gender inequality that assigns women as an inferior position in societies, and is unambiguously linked to the reduction in women's sexual desire and in irreversible loss of capacity for the type of sexual functioning that many women highly value. So, okay, the World Health Organization put out the statement and said that the difference, although both are both steeped in cultural tradition, is that, and they look the same with the partial removal of external genitalia, but the difference is that it's, for women, it's deeply rooted in gender inequality, which we have debunked per the words of like African women who undergo these practices. It doesn't assign them to an inferior position. That is one of the things that's hyperbolized. It's unambiguously linked to reduction in women's sexual desire. That has also been debunked, either through the perspectives of African women on their sexuality who have undergone these practices, but also like research just does not substantiate that to be true. And an irreversible loss of capability for sexual functioning, which is also debunked and not true. So there are statements for why these two things are different. The World Health Organization is not based in fact. So what is the difference between Mara and Scott, right? So we see that the reasons that they undergo these practices are the same, but the difference is like race, gender, whose body is legislated and policed and whose isn't. And I just want to be clear that my argument is not that girls or individuals with vulvas should be able to go genital sculpting practices and boys or individuals with penis should not. I just don't think it's the place of someone outside of a culture to dictate what should or should not happen within it, especially when the practice is being isolated from its wider cultural context and the meaning is scrutinized according to a foreign culture's values. I also question how invested folks would be in eradicating this practice if it did not disrupt familial systems and create space for infiltration of Euro-American power. So I don't think that it's my place to say that this practice should or should not happen in the African context amongst girls with vulvas. I also don't think that it's my place to say that this should or should not happen amongst Jewish boys or amongst Muslim boys. I do think that it is okay for me as an American to critique this practice occurring in my cultural context with my cultural values. And thus I can say I actually don't think that this should be happening in hospitals. Neither does the American Academy of Pediatrics, although they're not going as far as to say it should not. They are saying it does not have any sort of medicinal value. And it is basically a cosmetic surgery. And I just don't think that we should be doing cosmetic surgery on infants while we strap them down to boards without them being able to say what they want to happen to their bodies or not.
Could Dr. Lim at least talk to Mara again?
You want to wake her up again in pain?
So here we are coming back to Mara and finding out what is happening with her in the progression of this episode.
Could Dr. Lim at least talk to Mara again?
You want to wake her up again in pain?
Every woman deserves the right to make decisions about her sexuality without her parents hanging over her.
When I was 15 years old, my father caught me with a boy. I mean, we weren't doing it, but my top was off, and well, it doesn't matter. My father hit me. I still had a small scar. Our relationship was never the same. That's what growing up is. Not everyone gets called a slut. Not everyone gets butchered. But everyone becomes a man or woman and stops being a child. I want to take a piece of tissue from inside your cheek, and I want to graft it to your clitoris. We can make you feel love.
I can't turn my back on my family, on my traditions.
Traditions connect us to the past. What about the future?
Please. No, I'm in pain.
Trust me.
Prep the cheek as well.
She's taking the graft? The paperwork doesn't
She
say.
consented verbally. I didn't want to keep her awake any longer than absolutely necessary.
I wanted to help her as much as you, but she wanted help. But if she doesn't want this...
She wants this. Dr. Lim just told us.
Prep the cheek.
So, Mara said no. Her parents said no. She was awakened again and said no. And the doctor decided that it is the clitoris that actually produces the feeling of love. And if she could fix Mara's clitoris, then she could make her feel love. The Good Doctor, Neocolonialism, and Us. Neocolonialism in this context is the absence of cultural hermeneutics and anti-female GCM conversations. Cultural hermeneutics is understanding a society on its own terms, not ours, and evaluating it from its own perspective. Economic development and Euro-American education is a recommended method to push neocolonialist genital sculpting and mutilation agenda. So this is actually something that was stated as a factor to shift the feelings. And this was particularly considered in the context of South African male populations that do not undergo genital circumcising practices, and the Euro-American push to make these populations undergo genital circumcising practices under the guise of this will be helpful in HIV reduction. Again, education about penile health could also be helpful in HIV reduction, as opposed to forcing people that don't want to circumcise penises to circumcise penises. And again, there was an actual state that if we help them develop economically, if we bring in our education, then we will be able to have them undergo these circumcising practices in the ways that we want to. And Sambufu Some has a quote that says, "Few Africans who go to Western schools return connected to spirit." And in the context of this quote, spirit is to the cultural community and being the ethnic group, the values, the beliefs, the traditions, the cultures. And again, we see how this is actively happening right now, where there is a push into bringing a particular perspective into a community to make them adhere to Euro-American standards. I also just want to say that, like, trampling on an entire cultural group's autonomy cannot actually be a benefit. There are lucrative human rights campaigns and political capital that benefit those outside of the practicing communities for female genital sculpting. And then there's also money to be made in training, licensing, and practicing circumcisions amongst non-circumcising communities for male genital mutilation. Who actually benefits? There is a push for abolition of female genital sculpting, but a push for introduction of male genital mutilation, and the benefit is just really not to these communities. So neocolonialist African genital intervention, just a little bit of follow-up about what is happening right now in terms of like genital intervention on the continent of Africa. Among African communities that do not want our intervention, we are telling these communities that they must stop genital sculpting practices, and the communities that practice these rituals on girls stand against the medicalization of genital sculpting practices to prevent its legitimization, and do not participate in harm reduction education around increased sanitary genital sculpting practices. Or, I mean, maybe do not is it's a strong word. There are some pushes for education, but the bigger push is for abolition over education. And then among communities, again, that do not want our intervention, our goal is to introduce genital mutilation practices to communities that do not circumcise boys, to support the medicalization of genital mutilation practices, to enhance legitimization, and again, do not participate in harm reduction education, which is good penile hygiene practices, as opposed to saying start circumcising. I just want to come back to this quote that we read earlier in the presentation by Okazaki, David, and Abelman, and that is, there is enormous social, psychological, and infrastructural work in producing the colonized person. And I hope throughout this presentation you have been able to see how that social, psychological, and infrastructural work is occurring as it relates to the genital sculpting practices on African vulvas and penises. So what do we do now? With all of this information in Africa, what we do is nothing. Harmful practices can be dissolved within communities without Euro-American intervention. It has happened before amongst the places that we are now trying to introduce genital circumcision to boys. There was circumcision previously, and these communities got together on their own without Euro-American intervention and decided to end the circumcising practice. And the same can be true among these communities where circumcision practices or genital sculpting practices are occurring amongst girls. And maybe it doesn't just end the practice, you know, like maybe the community decides what is actually best that honors our rights and traditions and honors autonomy and consent. Like, we don't have to be involved in order for communities to make those decisions. But where we can be involved is in the United States, and there's something that we can do here. We can focus on the analogous human rights abuses that are occurring in hospitals and surgery centers across the country. We can also work to dismantle systems of oppression that feed our own human rights abuses. And these systems of oppression are capitalism, the medicalization of bodies, misogyny, body policing, and poor sex education. So this is where we need to direct our efforts. We need to stop trying to go into places that do not want us there and make them abide by our cultural values in really manipulative ways by like altering their education systems and like altering like playing around with their the ways that they make money and live. We can stop doing that, and we can just take all that energy and like bring it here and decide that we're going to stop the human rights abuses that are occurring in hospitals. Because if it's a human rights abuse in an African context among girls and vulvas, then it's also a human rights abuse here in the American context with penises. The moral of the story is neocolonialism is alive and well, and let's all mind our own genitals. So this is the portion where I had a small question and answer section at the end of the presentation. I'm not available for question and answer now, but what I will say is if you want to use this presentation and you want to share it or a part or piece of it, I would ask that you compensate me for that. I'm fine with this being free access, but if you use this presentation and you make money off part or all of this presentation in your presentation, I would ask that you record that onto me, and I will provide a space in the comment section below where you can send me a message or send money into my Venmo account. I hope you enjoyed this. It might have stirred a lot of things in you. You might have questions. There are places that you can go to look and see if maybe you can process this with other people. I think it's important to remember that when you're thinking about how you feel about these things, that there's a particular context and lens that you hold and other people that you might be discussing this with hold. And make sure, if you can, to have an African-centered perspective on this. If you don't know what that is, if you don't have access to anyone that can help you with that, then maybe you should build out your community a little bit more. And that doesn't mean necessarily go into a community and say, hey, I learned this thing and I want you to teach me about it, especially without compensating that person for that labor. But it does mean like just expand who is around you. If there's no one that you can talk to about this, you have a very limited worldview. And if you want to stay in that, you can. But if you want to be a true citizen of the world that's able to engage in intellectual thought about a variety of things cross-culturally and not just from one particular lens, then you actually do need to expand your group. So I hope you enjoyed it. And that is the end. Thank you for watching this far out.